Good afternoon, everybody, and thank you for inviting me here. I was very struck by the previous presenters, and Shirley talked about the youth, and it struck me that it's like that young girl, Greta Thunberg from Sweden, who started the momentum on climate change. And her book, she has a book of her speeches out, and the title of the book is "You're Never Too Young to Make a Difference." I think that's great, and congratulations to you. For Hamel from Afghanistan, and you wonder why things are changing in Afghanistan, I only walked in the door when he approached me. He had no idea who I was, what I did, or anything else like that. And within 2 seconds, he had his name and his contact details in my phone. So if you're wondering how things get done, they get done. So anyway, it's a good pleasure to be here. I have a lot of slides, but they're pictures, and a picture paints 1,000 words. So I will go through it. I think this is, ICN, I'll just talk 2 seconds about ICN. It's the International Council of Nurses. It was formed 120 years ago in 1899. It represents 130 countries worldwide and 20 million nurses. And basically what we do is we try to impact the global agencies. We try to be strategic in our leadership for nurses worldwide. We're the voice of nursing. And we try to empower our membership worldwide because, as you know, nurses make up 50% of the workforce population. And as Shirley already said, if we don't invest in the workforce, we won't have health and we won't have an economy. This was taken in June in Singapore, where we had our Congress, and it was beyond healthcare to health. And I think that's an important aspect of all we say and do. And if you think that I'm holding on to Tedros' hand, who's the Director General, I am, but it's not to let him go that fast because we held him for a full day, and now we've got a steering group for ICN and Nursing Now and WHO in relation to next year, which is the year of the nurse and the midwife designated by WHO, in order to make strategic plans for how we portray and how we profile nursing. And as he said himself, because of his experience in Ethiopia, we cannot achieve the targets of the Sustainable Development Goals or universal health, I'm used to saying care, coverage, or we cannot impact on the NCDs unless we invest in the workforce and unless we invest in nurses and empower them and equip them, and so that they can do what they should rightly be doing is increasing their impact in relation to the delivery of healthcare. Just to give you an idea of the people that we work with, and that's only a sample of the people that we work with, but some of our partners are the International Labour Organization, Professional Alliance, the World Health Professional Alliance, which are the physios, the doctors, the pharmacists, and the dentists. Those are them. We also work with a lot of different alliances in relation to Women Deliver, the Commission on the Status of Women, and all of those, because in order to make an impact, you cannot be always talking to yourself, so we have to talk to other people too. And one of the other areas that I'm very interested in is human trafficking. And we've just got engaged with quite a number of agencies in relation to human trafficking. And you think that human trafficking is not on our doorstep, believe you me, it is, right on our doorstep. And 75% of those trafficked are women and children, which is a terrible statement to stay in this day and age. And all the movement of people across the world is making it even worse. So it's something that we were asked to get involved in because the people who are trafficked, sometimes their first port of call is the emergency department or into the midwifery department. So the nurses have to know what to look out for and who to report things to. And it has made a difference. They have found 2 rings in England by doing just that. This is a document that came out at the Wish Forum in Qatar, last year, and you can say what it says for itself. And as has been said already, half of the world's population have no access to healthcare. But worse than that is the fact that 5 million of the population die from poor healthcare, whereas 3.5 million die from no healthcare. That's a terrible indictment on the kind of care we're providing. And I know Martin Luther King has been already spoken about, but in the words of Martin Luther King, I would like to say, health is a human right, and we'd like to see the same, my vision would be to see the same health care for all throughout the world. Because the first thing that all of you do, and we do, and I do, and throughout particularly the high income countries, is if you travel, what do? You take out health insurance. That's exactly what you do, because you think, I'm not going to get the care that I get at home in some other country. And that's not right. It is not right. I believe, and I hope I see the day when we have the same kind of health care in every country in the world. There is an issue when we talk about the product of our lifestyle and our environment. We are the product of our lifestyle and our environment, and we can change it. As was mentioned, I am on the Commission for NCDs. The report will be out, it will be published in Oman, as far as I know, on the 9th of December of this year. And it's a shocking state to say that 75% of the population die from NCDs. But more important than that is the age group that's most affected is the 30 to 69-year-olds. That's our age group, 13 to 69-year-olds. Now, they're the workers of today. How do we expect to grow an economy if those people are sick and if we don't do anything to stop that? And it's something that we can do something about, all of us. Every one of us can do something about it, because it's about obesity. It's about our sedentary lifestyle. It's about what we eat. And it's about what we drink and what we smoke and all of those things. We can achieve 20 years better quality of life if we do something about it. And in the NHS in England, they are now saying every interaction between the medical professional and all the health workforce in the medical arena can make a difference if they talk to the people that they meet every day, the patients, their relatives, their friends, everybody else like that. So it's make every interaction count. This is, if you see the arrow, this is me with the red jacket in the middle of all of those, mainly gentlemen. And it was the report on the NCDs. I am very committed to that. I'm very committed to the fact that we can do so much. And I know that you're all from different arenas and different backgrounds, but it's something that we have to take control of. There are a lot of things that we can't do something about, but we can certainly do something about cardiovascular disease, respiratory disease, diabetes, cancers, and mental health. Mental health is a huge, huge issue, from the youth to the elderly, and particularly the youth in relation to suicide. The one thing that's an issue for all of us, though, is the fact that we are 18 million workers short. That's the prediction by WHO for 2030. That prediction is inadequate. It says what we're short. It doesn't say what we need. You can double that and nearly triple that over the next couple of years. And let me tell you why. I was in China this week, and China have 4.5 million nurses to 1.3 billion. That is a third or a quarter of the ratio in most countries. They need to double that. In America, in the US, at least 1 million will retire over the next 3 or 4 years. In Africa, in Latin America, in the Asian countries, they're already short. Not alone are they already short, but their health systems can't afford to put money into actually employing the nurses they have. In South Sudan and other countries, the nurses are working for nothing. The doctors are working for nothing. They have to sell trinkets in the evening or at lunchtime to actually bring in money. That's the difference. We think we're badly off in these high-income countries. We're not. We have made the mistake, and I spoke to you earlier about this. Bringing in different models of care, or models of care from high-income countries to low-income countries is wrong. The country has to dictate for themselves what their model of care will be. And we haven't done well in high-income countries. What we've done is pushed all the money into the last few years of life and into tertiary care, but not into primary health care. We talk about it, but we do nothing about it. This is just an example of what nurses are trying to do. Over the last 3 years, I know I have only 2 minutes or something like that. Over the last 3 years, we have been collecting case histories from across the world. 3 minutes. I gained one. About nurses that are doing things in particularly bringing healthcare to those most in needs. The indigenous population, the people who can't access or who can't afford healthcare. So they're going out on horseback, on motorbikes, with vans to bring primary healthcare to people that they can. Against all the odds, against all the challenges, they're developing different models of care. And that's what we need to replicate, not what we're doing in countries that don't look at the real aspect of care, which is prevention. I'm going to go through this very quickly because these are some kind of examples of what nurses can do if they're empowered to do it. This is Stroke Nurses Services in Hong Kong, and nurses are intervening quite early in this because there is more of them than the doctors. This is older people in community health centres in Indonesia. And this is only a sample because you can go to Guatemala, you can go to Tonga, you can go to Malawi, you can go to any country in the world and you'll see different examples of things that are being done. What we have to do is try and replicate that. Remote areas to the indigenous people, because the indigenous people will be more affected than any other population with the usual diabetes, cardiovascular disease, and all of those. I don't need to tell you that. This was a report that was brought in by the All-Party Parliamentary Group in the UK, and it was, as it said, they found that increasing the number of nurses developing nursing so that they can achieve their full potential will have the wider triple impact: improving health, promoting gender equality, and supporting economic growth. And we need to promote gender equality, whether it be in nursing or whether it be in the whole wider population of. As a result of that, this is what developed: a campaign for nursing now about profiling what nurses can do. And as you can see, Lord Crisp developed it, and you can see our mentor is Kate Middleton, Her Royal Highness. The Year of the Nurse and the Midwife, that's what we're about. That's what we're going to try and make a greater impact, at least in bringing in more capacity in nursing, trying to influence governments to at least see that it's not just a health issue. It's not an issue for just the Department of Health. It's an issue for the whole of government. And that's what we're not seeing. The whole of government needs to be involved if they want to change the health of the population. And you cannot say strongly enough that healthy people make healthy economies. It's very simple. I see in leadership programs, if you develop leaders in all areas, but particularly in healthcare and in nursing, they can have an impact in policy because they're the ones that are closest to the patient. They're the ones that spread across from birth to death, from community to hospital to hospice care, they're the ones that should be involved in policy direction.